So when someone says, I really don't know what to do here, and you feel their frustration, you feel their confusion, you feel their worry. That's human. And that goes back to what Dustin, you were saying about watching football or reading a book, like feeling what someone else is feeling is the human element of it. And that then
Even if that person doesn't exist.
even if that person doesn't exist. And there's something really beautiful about our ability to do that and the way we follow storytelling. And it's just that go down that rabbit hole. How much I know we all love storytelling. We are storytelling beings. We've evolved that for a reason. Um, and so when it's simulating that, uh, and that's what maybe one thing that's unique about what therapy is two people having an emotional experience, that the therapist being really skilled at being able to employ that affective empathy appropriately and with boundaries and use it to communicate and use it for informed compassion and accurate empathy. Um, so that is something that it's uniquely human, like that so far as we know. But it can feel that way with AI, that it understands me and it feels what I'm feeling. It's always got my emotion correct because it can take guesses at what a person's words mean too, emotionally.
Is it more applicable to psychiatry than psychology? So I feel like, and you can correct me if I'm wrong, I feel like psychiatrists for the most part kind of have, I don't want to say like a set. I mean, we all have guidelines, but like they have like a specific set of things that they're looking for, and then they say, "Oh, this drug will work, or this drug will work, or this thing will work, or this thing will work." Like there's whereas with a psychologist, it's more about a discussion happening between a patient. Or am I wrong on that?
You're doing a distinction between what the role is versus what the profession is. So a psychiatrist might be doing therapy. They're typically able to be a therapist if they, and prescribers as well. Whereas most psychologists don't have a prescribing privileges in the state that they're in. And then not all and clinical psychologists or counseling psychologists tend to also be therapists. Therapist is not a licensed term, by the way. So it's licensed mental health professional, which can include psychiatrists, psychologists, social workers, counselors, a number of licensed mental health professions
I did
where,
not know.
and so, yeah. And so when
So
you
if
say
you're
like
out there looking for a
therapy,
therapist,
yeah, that's not a licensed term. So there's
okay.
nothing keeping any AI from saying like, this is a therapy bot. This is
Are Frank
no,
and I therapists?
Yeah, so we're therapists.
you can call yourself that. And you might now, if you start practicing out without a license, someone can come after you in your state as
I
a,
am
Oh,
so afraid of messing up someone's brain. I like not being a therapist. I'm afraid I'm going to give someone a bad suggestion. Like I got two kids, right? Even there. I'm like, I can't believe someone's telling me I got to tell them what to do. I don't know. Like so,
yeah,
you don't
yeah.
have to worry about that one. I've been called many things, but I don't think a therapist is in my future.
And that's really important. It's about boundaries. And that's where the question becomes, we have these AI, when people say AI and they're like, "Oh, I use it for therapy." And it's like, "Well, what is it? Is it a mental health chatbot that's been programmed and trained and actually has limitations on what it's gonna help you? And has it been trained about crisis management?" And that's where we do see the cons of AI right now, whether it's the bots that have been specifically trained for mental health and crisis management all the way through your Omni bots, your ChatGPTs, whatever.